Intervertebral discs are marvels of engineering, shock absorbers that let us walk upright, bend, twist, and bear weight. Yet when they start to degenerate, they become one of the most frustrating tissues in the body to heal. Unlike muscles or skin, which repair quickly after injury, discs often deteriorate slowly and irreversibly, leading to chronic pain, reduced mobility, and a cascade of spinal dysfunction. At the center of this problem is a biological reality. Intervertebral discs are largely avascular, meaning they lack direct blood supply. This makes them extraordinarily difficult to regenerate and poses major challenges for delivering therapeutic compounds. But the emerging science of senolytics, drugs that selectively remove aging, dysfunctional cells, offers a promising new way forward. Instead of replacing or rebuilding discs surgically, we may soon be able to rejuvenate them from within. To understand why healing discs is so difficult, we first need to understand their structure. Each intervertebral disc is made up of two main components: the nucleus pulposus, a gelatinous core that absorbs pressure, and the annulus fibrosus, a tough outer ring of fibrous tissue that contains and stabilizes the core. These structures are surrounded by cartilaginous end plates that connect the disc to the adjacent vertebrae. Crucially, none of these regions have their own dedicated blood vessels. Instead, nutrients and waste products must diffuse across the end plates, a slow, inefficient process that becomes even less effective with age or injury. This lack of vascularity is a double-edged sword. On the one hand, it protects the disc from inflammation and immune attack. On the other hand, it drastically limits its ability to heal. When disc cells are damaged from mechanical stress, oxidative injury, or simply aging, they are rarely replaced. Instead, many enter a state of senescence. They stop dividing, lose function, and begin secreting harmful molecules that damage surrounding tissue. Over time, these senescent cells accumulate in the disc, releasing pro-inflammatory cytokines, matrix-degrading enzymes, and reactive oxygen species. This toxic soup, known as the senescence-associated secretory phenotype, SESP, degrades collagen and proteoglycans, weakens the disc structure, and sensitizes nearby nerves, creating a perfect storm of inflammation and chronic pain. Standard treatments like NSAIDs or corticosteroids do little to reverse this process. They may suppress inflammation temporarily, but they do not remove senescent cells or repair the underlying tissue. Even regenerative strategies, like injecting stem cells or growth factors, often fail because the harsh, inflamed microenvironment of a senescent disc can kill off transplanted cells before they take hold. And the poor vascularity of the disc means that most injected drugs are rapidly degraded or fail to reach therapeutic concentrations, limiting their impact. This is where senolytics come in. Unlike most drugs, which try to override the effects of senescent cells, senolytics aim to eliminate them entirely, allowing healthy cells to repopulate the tissue and restore balance. In animal models, senolytic agents like dasatinib, quercetin, and fisetin have been shown to selectively kill senescent disc cells, reduce inflammation, and preserve disc height and hydration. Remarkably, even in aged animals, clearing senescent cells has led to measurable improvements in spinal health and function, suggesting that disc degeneration is not entirely irreversible. But getting senolytics into the disc remains a key technical challenge. The avascular nature of the tissue means that oral medications may not reach the disc in sufficient amounts, and direct injection is technically difficult and carries risks, such as infection, disc injury, or leakage. That said, researchers are exploring novel delivery systems, including nanoparticles, hydrogels, and tissue-penetrating peptides that could carry senolytics directly into the disc and release them gradually, maximizing their local impact while minimizing systemic side effects. There's also growing interest in prophylactic senolytic therapy, using these drugs in middle age or early in the degenerative process, before disc structure has collapsed. Because senescent cells accumulate gradually, intermittent treatment could keep their numbers low and delay the onset of degeneration, buying years, or even decades, of spinal resilience. Such preventive strategies could be especially valuable for people at high risk of back pain, those with physically demanding jobs, obesity, poor posture, or genetic predispositions. Importantly, senolytics may also enhance the effectiveness of other regenerative approaches. By clearing the inflammatory barriers created by senescent cells, these drugs could create a more supportive environment for stem cell engraftment or tissue engineering. A two-phase approach, first clearing senescent cells, then delivering regenerative agents, might overcome the limitations of both strategies and open the door to true biological repair of spinal discs. Of course, challenges remain. Not all senescent cells are bad. Some play roles in wound healing and tumor suppression. Precision targeting will be essential to avoid unintended consequences. Clinical trials are still in their early stages, and questions about long-term safety, dosing, and delivery must be addressed before senolytics can be widely adopted. Still, the potential is extraordinary. For decades, the dominant narrative around back pain has focused on mechanical failure, bulging discs, herniations, and misalignments. Now, we're beginning to recognize that cellular failure may be the deeper culprit and that reversing it is biologically possible. Senolytics offer a new therapeutic language, one that speaks not in terms of masking symptoms or surgically replacing broken parts, but in restoring the body's own capacity for renewal. In summary, intervertebral discs are notoriously hard to heal because they are biologically isolated, slow to regenerate, and prone to cellular decay. But senolytic therapy may finally give us the tools to change that reality by clearing out the dysfunctional cells that poison spinal tissues from within and allowing new growth to take their place. It's not just about treating back pain, it's about changing the biology of aging itself.